In this section, we're going to talk about something that is really very important but often underlooked, and that is first impression. We'll talk about why it is important to make a good first impression, what is a good first impression from a physician's standpoint, and we'll also at the end talk about how pharmacists can show up professionally. So first impression is really very important because science teaches us that people will make a first impression about you in less than 10 seconds. Can you imagine that? In less than 10 seconds, somebody will decide whether they like you or not, whether they can interact with you or not. This is really very crucial because every interaction leaves an impression. So how you interact with a person the first time you meet them will let that person know whether this relationship will be long-term or short-term. Mind you, they will still communicate with you, but they will have a different impression about you. And because of that, they will treat you in a specific way. And that is why I said by you taking the CRQ training, we have to be able to challenge the unconscious bias that goes through our perception. We learn not to look at people through our own narrow lens, or we have to always understand that people will be looking at us through that narrow lens, and the way they would perceive us will be based on their own beliefs. And when we deal with people, we also have to understand that that is what we are doing to them. So with collaborative relational intelligence, you are behooved to challenge your unconscious mind, and that is why everything has to be intentional. So one professor at Turf University did a study. And in this study, what she did was she brought a professor that was just hired within the first 3 months to students in the class and asked the students to write about this professor, what they thought of this professor. 2 years later, she brought the same professor. What those students wrote never changed after 2 years. And that is how powerful first impression is. Okay. And so with first impression, we always want to think about unconscious bias. Know that people are looking at us through a lens that enables them to distort, exaggerate, delete information, or sometimes don't even remember why, because people's perception is shaped by their belief, who raised them, which country they are from. And so many different things are happening. So I always tell people that in order to make a good first impression, always show up for success. And people will start judging you based on your outward look. So they'll be looking at your outfit. This is so important because in my profession, as a senior clinical consultant and an expert in physician engagement, when I go in to talk to physician, this is what happened. I realized that sometimes they remember me. If I had been there maybe 2-3 years ago and I go back there for something, they remember me based on the outfit I wear. Remember, I went into an office. When I went there 2.5 years later, once I walked in, the physician's wife was the manager. She screamed, she said, go call the doctor. That lady that came here dressed in a lime suit, she literally described everything I wore. And she said, you left such a good impression here. When you left, we kept talking about you. If somebody takes that time to remember what you wore, can you imagine 2.5 years before? It tells you how important first impression is and how cataclysmic it can be if we don't show up properly. So we always have to make sure. And that is just an example. I've heard so many people. Some will say, oh, they describe me as the lady that came in with the red suit. Why? Because I made that first impression. And usually when I even go in to talk or have meetings with the doctor at the front desk, there's something I do. I always make sure that the patients are taken care of first. And then I'll go and introduce myself and tell them why I'm here. But because of how I look, you can see the people at the desk trying to pay more attention to me than the person they are talking to. So invest a lot in your dressing. But for first impression from a physician standpoint, they are people that really like quality. So if you have a suit, make sure that you have quality dressing. If you're trying to make that first impression when you're around physician, make sure that everything you have is quality. When I'm meeting with physicians, because I know they love quality and I understand the power of a pen, I always make sure I carry good pens. So if I am dressed like today that I have the silver jewelry, I'll carry a pen like this. If I'm wearing gold jewelry, I carry this pen. And during most of my workshops, I always pass out pen because studies have also shown that when you carry a good pen, you make a good first impression when you meet people. Can you imagine? Not only is it scientifically proven, I, through experience, have realized that. So when I'm talking to physicians, They're not telling me that, oh, your pen looks good. No, physicians are not like that. But what I realize is that when they are talking to me, they are looking at me, looking at my pen, and listening to what they are I'm saying, because they are trying to see whether I'm giving them quality answers. And then they're also thinking, well, if somebody realizes that quality is important and they can take the time to buy this, it means there's something about this person that is balanced. So they start seeing me as them because this is what they too would get if they wanted to get something for themselves. So little things like this really make a huge difference. So Smize is really powerful, and I like to show you a picture of it. To Smize, you want to smile with your eyes. And Tyra Banks is the queen of this. So when you smile with your eyes, there's another type of smiling called Dungeon smiling, where you smile broad and stuff like that. But when you're talking to a physician, you don't want to be too personal, because sometimes when you over smile, you become too personal and too needy. So, but when you smile with your eyes, guess what? It comes in from your soul and your heart, and it looks very genuine. But at the same time, it is not indicating something. You're not giving away anything. You come across as being friendly and powerful, and you come across as being really likable. So you want to always remember to smile with your eyes. So when I train people during my workshop, we'll actually pause for some time and practice smiling with our eyes. But for the purpose of this webinar, I just want you to know that it's important, smiling with your eyes. Practice, 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 practice. When you're waiting to talk to a physician, smile with your eyes. When you're getting into a meeting, practice smiling with your eyes, because that will create a fabulous or a wonderful first impression. Name. I already talked to you about how important it is when you are talking to people. You want to make sure that you address them properly. You want to make sure that you know their right names, and when you're communicating with them, always make sure that you mention their name. The other thing we have to know, we have to be very careful not to attribute alliances to people, like nicknames, without their permission. And it's always okay sometimes. So I know with physicians, we'll always call them Dr. This, but let's say you're talking to a patient, it's okay for you to ask, how would you like to be addressed? When in doubt, just go with Miss or Mr. Miss with MS is attributed to married and single people. But when in doubt, in America, the cultural is okay to call people by their first name. So for example, avoid calling somebody who is called Catherine Kathy, or somebody that is called Elizabeth Eli, because they might not like that. And that is one big mistake you want to really avoid when you're trying to build rapport with people and communicate with them effectively. Pay attention to their name, ask them how they would like to be called, and you address them as such. With physicians, we know they are doctors, so you want to address them as such. Handshake is really important. When you are giving handshake to a physician, a firm handshake is good. But just make it short and go back to your task. But then in the hospital, though, you got to really be careful. When I'm talking to physicians, when I meet them, I just avoid shaking hands, because you know what? It can become a breeding space for germs. So, and with physicians, because they are impersonal, if you skip that part, that is not really a big deal. Okay, you can just say hello and dive into what you're trying to discuss with them. So that is also okay. But with handshake, we have to realize that based on the personalities, the handshake you give a deep personality, they recognize smartness and strength by firm handshake. So you want to make it really firm. I say this to the S personality because the S personality, for one, is one personality type that really would not appreciate it if somebody comes and gives you a very firm handshake. So if I was dealing with an S personality, I want to make sure that it is very gentle, right? But for you, S personalities, you want to make sure you want to adapt to the personality of others by not giving a weak handshake. Make sure you give a firm handshake. Give a very firm handshake when shaking hands with the deep personalities. But with the physicians, you give a firm handshake, but if you avoid it, that is okay. But this also goes to tell us how unique we are. How, in general, most leadership training will tell you when you walk in there, just give a firm handshake. No. If you want to communicate effectively and build proper rapport with the S personality, you want to give them a gentle handshake. With the I personality, you want to give them handshake that makes them feel that you care. Okay, so we have to realize that people are wired uniquely. We cannot treat people the way we want to be treated, and we cannot treat people as if it's one shoe fits all. No. Title is also very important, how you address people. So if you're talking to a physician and they are somewhere small, you don't go down and say, oh, Mr. Sam, you say Dr. This, because your title now really reflects a lot. You are communicating with him based on the fact that he's a professional in this particular area, and you're bringing this question to him because you know that he has the solution. And with physicians, again, they like to keep it professional, be as professional as possible. Your outward look in general should be professional. Remember, physicians hate being touched. Keep your hands to yourself. Don't pat them on their back. Don't talk and elbow them like that. It's a turn off. It breaks rapport. We have to really be very careful when doing that and dealing with physicians. So remember, first impression is important. You know, a lot of people say, listen, I like to be my authentic self. So some people say, oh, they can show up anywhere in life. Your dressing is important. You will be judged first by how you look and your body language. When you start coming, it's your outward look that will create that first impression. There are lots of studies on this. So always learn to dress for success. So for example, now I'm a professional person and I go for professional meetings with physicians. If I was a mechanic, I will not go to work dressed up like this. So, and a mechanic will not want to go to work and dress in suit or with a white jacket because, again, think about it, it will be inappropriate for what they are doing. So the key is always dress for success. As I wrap up this section, I would like you to just pause for a minute and write down 5 ways that pharmacists can make a good first impression with physicians. We've talked about a lot. Think about paralinguistic, think about matching and mirroring, think about pacing and leading, think about the visual, the auditory, and the kinesthetic, using their name and repeating their words. Okay, just think about all that while we prepare to get into the next section.